More than 85% of adults over 60 still eat cheese at least twice a week. That is not the problem. Cheese, eaten correctly, can be one of the most powerful foods in your diet after 60. The problem is this. Nearly every senior is making the exact same mistake at the cheese counter, not because they are careless, because nobody has taken the time to explain which cheeses protect an aging cardiovascular system and which ones quietly work against it. The worst cheese on today's list carries a specific biochemical risk that most people have never been warned about, one that is particularly dangerous for anyone over 60 managing blood pressure or taking common medications for depression or Parkinson's disease. The best cheese on this list delivers compounds that research links to measurably lower arterial calcification and better bone outcomes at levels no supplement currently replicates through the same mechanism. In the next 15 minutes, I am going to walk you through 4 cheeses to add to your plate and 4 to remove from it permanently. After 2 decades working in health and aging, I've seen too many patients harmed by choices they made with complete confidence because nobody gave them accurate information. That ends here. Before we go any further, drop a comment right now with your age and the one cheese you eat most often. I want to see who is watching because what I am about to share applies differently depending on your medications and your specific health conditions. And if you have ever noticed heart palpitations, skin flushing, or a headache after eating certain cheeses, add the word reaction to your comment. That symptom is more significant than most people realize. I will explain exactly why in a few minutes. Here's the conversation that happens constantly in routine medical appointments. A 68-year-old comes in for a cardiac checkup. The doctor reviews the diet, cheese comes up, the advice is reduce dairy, watch the saturated fat, the patient goes home and eliminates cheese almost entirely. 6 months later, bone density is lower, protein intake is down, the arteries are no better than before. This happens because the discussion about cheese is not being had correctly. The question has never been whether to eat cheese, the question is which cheese, in what form, and for what specific physiological purpose. The research that has emerged on fermented and aged dairy over the past decade is considerably more nuanced than the old saturated fat narrative allowed. A 2020 meta-analysis published in the European Journal of Epidemiology, examining data from over 900,000 participants, found that fermented dairy products specifically showed a modest protective association with cardiovascular outcomes. Most physicians have not updated their dairy guidance in light of that evidence. The gap between what the current research shows and what seniors are being told in appointments is producing real harm. Unnecessary restriction of beneficial foods alongside continued consumption of highly processed alternatives that offer nothing the label claims. If you want to understand the why behind what goes on your plate, not just a list of rules, here is the framework that makes cheese selection after 60 genuinely different from any earlier stage of life. 3 physiological changes matter here. First, stomach acid production declines with age. That acid is the first step in protein digestion. When it is insufficient, proteins pass through the gut partially undigested and trigger low-grade inflammation. Cheeses aged for 18 months or more arrive at your gut with proteins already broken down into shorter peptide chains. By the aging process itself, your digestive system does not have to do that work. This is the difference between a food that feeds you and one that inflames you. Second, calcium metabolism shifts after 60. Without adequate vitamin K2, found in meaningful amounts almost exclusively in certain aged cheeses and fermented foods, calcium absorbed into the bloodstream is not reliably directed into bone. It drifts, it deposits in arterial walls, it contributes to calcification and stiffness. The right cheese delivers calcium alongside the K2 that tells your body where to put it. Third, your ability to break down biogenic amines, compounds like histamine and tyramine that form during protein fermentation, decreases with age because the enzymes responsible for this process become less active. In younger adults, these enzymes clear biogenic amines before they can enter systemic circulation. In seniors, especially those on certain medications, they do not. This is why the number 1 worst cheese on today's list is specifically dangerous for older adults. In a way, it is not for a 35-year-old. These are not minor details. They are the reason this conversation is different after 60. The 4 best cheeses. Starting at number 4, aged Gouda, not young Gouda, specifically Gouda aged for a minimum of 18 months. The distinction matters at the molecular level. During long aging, the proteins break down into shorter peptide chains. Your aging digestive system absorbs far more efficiently than intact protein. That efficiency matters when stomach acid production is declining. The more important reason aged Gouda belongs here is vitamin K2 in the metaquinone 7 form. A prospective study from the Rotterdam cohort published in the Journal of Nutrition falls followed over 4,800 adults and found that higher dietary K2 intake was associated with a 57% lower risk of coronary heart disease mortality and a 52% lower risk of severe aortic calcification compared to the lowest K2 intake group. The same associations were not found for vitamin K1, which is the form found in leafy vegetables. K2, found primarily in aged cheeses and certain fermented foods, is the protective form. Aged Gouda is one of the richest readily available sources. Look for Gouda labeled aged, reserve, or old at a specialty cheese counter. 1 ounce with your main meal, where dietary fat supports fat-soluble vitamin absorption. Number 3 is genuine Parmigiano Reggiano, not the pre-grated powder in a green container, the imported cheese from Emilia-Romagna, aged 24 months or more under protected production standards. 1 ounce contains approximately 10 grams of complete protein. The 24 to 6-month aging process hydrolyzes those proteins so thoroughly that the peptide chains are already highly bioavailable before the cheese even reaches your plate. For seniors with reduced stomach acid, this is mechanistically significant. Calcium content is approximately 335 milligrams per ounce, comparable to a full glass of milk, but delivered alongside the naturally occurring phosphorus and magnesium ratios in the cheese matrix. Calcium absorption from food is dramatically more efficient when these mineral cofactors are present in appropriate proportions, as they are in traditionally made aged cheese. The cheese also contains meaningful levels of tyrosine, a precursor for dopamine and norepinephrine, neurotransmitters that decline with age and neuroinflammation. Getting amino acid precursors from food is a gentler, more regulated pathway than supplementation. Eat it in small broken chunks after your main meal, as is traditional in Italy. That preserves the crystalline amino acid and mineral structures that grading disrupts. Number 2 is raw milk cheddar from grass-fed cows aged at least 60 days. U.S. regulations require 60 days of aging for raw milk cheeses, which allows the acidification process to naturally eliminate pathogens while preserving the heat-sensitive enzymes, probiotic strains, and fat-soluble vitamins that pasteurization destroys. The result is a living food that no pasteurized alternative can replicate in nutritional profile. Milk from grass-fed cows contains higher concentrations of conjugated linoleic acid, or CLA, than grain-fed dairy. Research has documented anti-inflammatory and immune-modulating properties associated with CLA. Grass-fed raw cheddar delivers CLA alongside the intact enzyme matrix that supports its absorption. The fat-soluble vitamin content is a significant advantage. Retinol in its direct bioavailable form, vitamin K2 in the MK4 form, meaningful vitamin D. Fat-soluble vitamin deficiency in seniors over 65 is far more common than most people recognize, and this cheese delivers multiple deficient nutrients simultaneously in the fat matrix, needed to absorb them. The probiotic bacteria in raw cheddar produce butyrate, the primary fuel source for the cells lining your intestinal wall. Butyrate production declines in seniors with compromised gut microbiome diversity. Getting it from food allows gradual, sustained delivery. One rule: never heat this cheese above approximately 120 degrees Fahrenheit. That threshold destroys the beneficial enzymes and probiotic strains. Eat it at room temperature, paired with naturally fermented vegetables when possible, to create a synergistic effect on gut microbiome diversity. Look for the words raw milk and grass-fed on the label. If the cheese is labeled pasteurized, it is a fundamentally different product. The nutritional benefits described here apply specifically to the raw aged form. Number 1 is authentic Swiss Gruyere. Real Gruyere, produced under Switzerland's protected designation of origin, is made from raw alpine milk and aged a minimum of 12 months. The propionic bacteria cultures used in its fermentation produce propionic acid as a metabolic byproduct. Research published in nutrition journals links propionic acid to reduced systemic inflammation markers, improved cholesterol metabolism, and inhibitory effects on inflammatory pathways involved in colorectal carcinogenesis. The same pathways targeted by certain anti-inflammatory medications delivered here through a food matrix. The same bacterial cultures synthesize vitamin B12 during fermentation. B12 deficiency becomes nearly universal after 65 due to the decline in intrinsic factor production. Fermented cheese-based B12 may be delivered through a pathway that requires less intrinsic factor dependent absorption than B12 from meat. This makes Gruyere specifically valuable for seniors with compromised stomach acid. The mineral matrix is exceptional for senior physiology. Phosphorus, zinc, and selenium working together. Zinc supports over 300 enzymatic processes, including immune function. Selenium activates thyroid hormone, a function that declines with age. Phosphorus and calcium work in tandem for bone matrix integrity. Gruyere also contains naturally occurring bioactive peptides with documented ACE inhibitory activity, meaning they lower blood pressure structure through the same mechanism as a class of antihypertensive medications, but without the medication's side effect profile. This does not replace medication. It represents a real functional benefit that processed dairy cannot offer. Melt it gently into warm soups just before serving, or eat it with whole grain bread. Keep the heat low enough to preserve the bioactive peptide structure. A 3-year longitudinal study examining elderly Swiss populations documented meaningfully better preservation of lean muscle mass in seniors who consumed Gruyere regularly, compared to age-matched seniors getting equivalent protein from other dairy sources. That outcome aligns mechanistically with Gruyere's unique diet and tripeptide protein structure, which allows direct intestinal absorption without requiring the full enzymatic cascade that larger intact protein molecules demand from a digestive system that has been quietly losing capacity for decades. Now, the 4 cheeses that need to leave your kitchen. Number 4 is individually wrapped processed cheese slices, the most consumed dairy product in America and one of the most metabolically damaging for seniors who eat it habitually. These products must legally be labeled cheese product rather than cheese because they typically contain less than 51% actual cheese by weight. The rest is emulsifiers, phosphate salts, industrial fats, artificial colorants, and preservatives. The label shows calcium and protein, but the chemical matrix those nutrients are embedded in actively undermines the physiological processes they are supposed to support. Sodium is the immediate cardiovascular concern. 2 slices can deliver over 600 milligrams, primarily from disodium phosphate and sodium citrate. Peer-reviewed cardiology and nephrology research has linked dietary phosphate additives specifically, not the phosphate naturally present in whole foods, to accelerated arterial stiffness and elevated cardiovascular mortality risk, with effects most pronounced in adults with even mildly reduced kidney function. Kidney function declines predictably with age regardless of diagnosed kidney disease. Research published in Nature in 2015 found that 2 common food emulsifiers found in processed cheese, carboxymethylcellulose and polysorbate 80, disrupted the gut microbiome, promoted intestinal inflammation, and increased gut permeability at doses relevant to typical human consumption. Gut microbiome disruption in seniors accelerates systemic inflammation, worsens insulin resistance, and contributes to cognitive decline. Processed cheese slices are not a form of dairy nutrition. They are a separate category that happens to share a name with real cheese. Number 3 is pre-shredded cheese in bags. The cheese itself is not the problem. The anti-caking agents are manufacturers add cellulose from wood pulp, potato starch, and in many products natamycin, a broad-spectrum antifungal antibiotic to prevent clumping. These can account for up to 4% of the product by weight. Cellulose in those quantities can physically coat cheese particles and interfere with your digestive system's ability to extract fat-soluble vitamins from the cheese's fat matrix. For seniors already at risk of vitamin A, D, and K2 deficiency, eating a food source of those vitamins inside an absorption-blocking coating defeats the purpose entirely. Natamycin is a clinically active antifungal used in medicine. Repeated daily dietary exposure has the potential to suppress beneficial microbial species in the colon, contributing to gut dysbiosis with all the downstream inflammatory consequences discussed above. The shredding process also accelerates oxidative degradation of vitamin K2 and beneficial fatty acids through increased surface area exposure. And greater surface area provides more opportunity for histamine-producing bacteria to colonize the cheese, which matters increasingly as your histamine-degrading enzyme activity declines with age. The solution is simple. Buy block cheese and shred it yourself immediately before use. 5 minutes. That is the entire intervention. Number 2 is shelf-stable jarred cheese spreads. If a cheese product does not require refrigeration until opened, that tells you something important about what it contains. Shelf stability at room temperature requires processing that removes every biological and nutritional characteristic that makes real aged cheese valuable. Many commercial cheese spreads contain partially hydrogenated vegetable oils, trans fats. The FDA moved to eliminate them from the food supply in 2015 because the cardiovascular harm evidence was considered conclusive. They persist in some formulations sold where regulations are less strict. Products that replace them with intrasterified fats are not clearly safer. Preliminary research suggests intrasterified fats may impair insulin sensitivity and generate a more atherogenic lipid profile than the natural saturated fats in real aged dairy. The sodium burden is extreme. A standard 2 tablespoon serving frequently delivers 400 to 600 milligrams, almost entirely from industrial emulsifying salts including sodium hexametaphosphate. Research has linked these specific additives to elevated fibroblast growth factor 23, a hormone associated with increased cardiovascular mortality in seniors with declining kidney clearance. Many of these products contain glutamate compounds concealed under labeling terms like natural flavoring, autolyzed yeast extract, or hydrolyzed protein, all permitted without explicit MSG disclosure. Cardiovascular reactivity and migraine induction in sensitive adults are documented associations. There is no nutritional case for these products. Remove them. Number one is blue cheese. And I want to be precise here because this one requires nuance. Blue cheese is not dangerous for every adult. In occasional servings for a healthy person not taking certain medications, it is a food, not a toxin. The specific danger is for seniors, and it comes down to tyramine, a biogenic amine present in blue cheese at concentrations significantly higher than in most other aged cheeses. Tyramine forms inevitably during the extended protein fermentation that gives blue cheese its characteristic flavor. In younger adults, monoamine oxidase enzymes in the gut wall liver metabolize tyramine rapidly before meaningful quantities enter systemic circulation. In seniors taking monoamine oxidase inhibitors prescribed for depression, Parkinson's disease, and certain anxiety conditions, that enzymatic barrier is pharmacologically blocked. When tyramine from blue cheese enters the bloodstream without being metabolized, it triggers a release of norepinephrine from nerve terminals. Blood pressure rises sharply and acutely. The result is a hypertensive crisis that can precipitate a stroke or cardiac event. This is not theoretical. The tyramine-MAOI interaction is one of the most well-documented drug-food interactions in clinical pharmacology. It is listed as a serious contraindication on every MAOI prescription. Even for seniors not on MAOIs, tyramine can still cause blood pressure fluctuations, headaches, and cardiovascular stress in adults with declining amine metabolism. And blue cheese's histamine content presents a parallel concern. For anyone who noted the word reaction in the comments earlier, blue cheese is the most likely dietary culprit. For most adults over 60, particularly those managing blood pressure or on any neurological or psychiatric medication, the risk profile of blue cheese is not justified by what it offers nutritionally. Here is what this means. Starting tonight, you are not being asked to give up cheese. You are being asked to upgrade it. 4 cheeses to add: aged Gouda, genuine Parmigiano Reggiano, raw milk, grass-fed cheddar, and authentic Swiss Gruyere. All available at most specialty grocery stores, all delivering protein, bone-protective minerals, and cardiovascular relevant compounds and forms your body can actually use after 60. 4 to remove, individually wrapped processed slices, pre-shredded bagged cheese, shelf-stable jarred spreads, and blue cheese for anyone managing blood pressure or on neurological and psychiatric medications. 3 actions you can take now. Read the label on every cheese product currently in your refrigerator. If it says cheese product rather than cheese, or if the ingredient list contains more than milk, salt cultures, and enzymes, it belongs in a different category than you think. Switch to block cheese and shred it yourself before use. This single change eliminates anti-caking agent exposure and preserves the fat-soluble vitamins you are eating cheese to obtain. If you are on any medication for depression, Parkinson's disease, anxiety, or blood pressure, bring a list of fermented foods you eat regularly to your next appointment and ask specifically about tyramine content. That 3-minute conversation could prevent a serious event. Drop a comment right now saying upgraded if this gave you something concrete to act on. I want to see that word. It tells me you understand that cheese choices after 60 are not minor preferences. They are decisions with measurable biological consequences. Think of one person you know over 60 who eats processed cheese slices daily or puts blue cheese on everything without knowing about the tyramine issue. Send them this video right now. That single action may matter more than you expect. Subscribe to this channel. What I bring here is evidence-grounded health information that most people only encounter after something has already gone wrong. You deserve to know it before that. In the next video, I will cover the specific vegetables that research links to meaningful reductions in arterial stiffness in adults over 60, how they work at the vascular level, and the preparation mistake that destroys most of their benefit before it reaches your bloodstream. This video is for educational and informational purposes only. It is not a substitute for medical advice. Dietary choices, especially if you are managing cardiovascular disease, kidney function, or taking prescription medications, should be discussed with your healthcare provider. The information presented reflects published research but does not constitute individualized medical guidance. Never adjust or discontinue any medication without first consulting your physician.